Hello all, it's Dr. Ruth Dotnier. I'm a board-certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental illness. Now today we're going to be talking all about insulin resistance. Specifically, how do I know if I have it? Now, why is this important? Well, of course, we all think of insulin resistance as the precursor to diabetes. And of course, that is true, but you may not also know that insulin resistance is strongly associated with many mental health conditions, including anxiety and depression. And this is probably because when our brain cells are insulin resistant, they're not able to utilize the carbohydrates and sugar that you're eating for fuel efficiently. And so this causes metabolic dysfunction, which can lead to mental health symptoms. So how do I know if I have insulin resistance? Well, most people get diagnosed with prediabetes when their primary care doctor orders a blood test called a hemoglobin A1C, which is a measure of the average blood glucose level over the last 3 months. And if this level is slightly elevated, but not so elevated that it's in the diabetic range, then they get that diagnosis of prediabetes range. Now it depends on the lab, but generally this range is going to be somewhere between 5.7 and 6.4. But what if I told you that this is not the best measure for insulin resistance? And this is because by the time you start to have an observable change in your blood glucose levels, you are likely to already have had insulin resistance for years and to be well on your way to developing diabetes. So how can we tell this earlier? Is there a better way? The answer is yes, absolutely. First, you can get your doctor to order a fasting insulin level. If this level is elevated, it indicates that your body has been repeatedly releasing large amounts of insulin over and over again in response to large amounts of carbohydrate loads, and that your cells are now becoming resistant to that insulin. And so in response, your body produces more and more insulin in order to combat that resistance. This is insulin resistance. Now, although this test is not all that commonly ordered in primary care, it is often covered by insurance, and even if it's not, it's very cheap. It's about $15 per test, so something worth asking about to see if your primary care is willing to order it. Now, we don't have standardized guidelines for what your fasting insulin level should be, but it's generally accepted that a level of 5 or less is excellent, and a level of 10 or greater does put you at increased risk of insulin resistance. And obviously, the higher the levels, the more likely you are to be insulin resistant. If you have a level of 20, 30, you're insulin resistant. Another test that you could ask your doctor to order is called a HOMA-IR, and this is actually a calculation of your fasting glucose times your fasting insulin over 405. Again, it's not really any new information, it's just going to be a calculation based on those values. Now, these two laboratory tests are not necessarily routinely ordered in primary care practices in the United States today, but again, it's worth asking to see if they can order them. One test that you will almost certainly get ordered on your routine annual physical, and that is going to give you a lot of information about insulin resistance, is your fasting lipid panel. Now, there's 3 important values that your fasting lipid panel is going to include. It's going to include your HDL, or your good cholesterol, your LDL, or your bad cholesterol, and your triglycerides. Now, your triglycerides are going to be most closely linked with your glucose levels. So if your triglycerides are high, chances are that your glucose levels have also been high. Now, most guidelines say that if your triglycerides are 150 or less, that's technically normal. But we now know that if your triglycerides are over 100, it puts you at greater risk of insulin resistance. So one approximation of insulin resistance that's really useful is the triglyceride to HDL ratio. If this ratio is greater than 1.5, then you are more likely to have insulin resistance. So let me give you some numbers for an example. So for reference, we recommend that men have an HDL of at least 40 and women at least 50. So let's say we have 2 men. One has an HDL of 80, which is excellent, and a triglycerides of 80, which is excellent. And that gives them a ratio of 1, right? 1/1. And so that person has a very low risk of insulin resistance. Now we have individual 2. This man has a triglyceride level of 140, still technically normal. And they have a HDL level of 45. Again, still technically normal. But if you look at their triglyceride to HDL ratio, it's going to be 3.1, which is more than twice what we recommend. So it's important to keep this in mind, because even if your lipid panel is completely within the normal range, it doesn't necessarily mean that you're metabolically healthy. You have to look at the actual values. So let's say that you can't get in to see your doctor, or that they won't order any lab tests for you. Well, one easy, free An at-home assessment that you can do is looking at your waist to height ratio. This is measured by taking the circumference of the narrowest point of your waist and dividing that by your height in inches or centimeters, depending on where you are. If this value is greater than 0.5, you are at high risk of insulin resistance. Okay, so we've talked about some numbers, but what might some signs or symptoms of insulin resistance be that could be correlated with these numbers? Of course, as our last measure might indicate, if you tend to carry a lot of weight in your midsection, that is a sign of insulin resistance. That's why it's going to lead to that high waist to height ratio. Additionally, high blood pressure is often associated with insulin resistance, and we think there's even a causative relationship there. Additionally, increased susceptibility to infections, development of multiple skin tags, and darkening of skin. This is because insulin is a growth hormone, and so it's causing excessive growth in those skin areas that shows up in those different features on your skin. Additionally, weight gain, fatigue, and persistent hunger can all be symptoms of insulin resistance. Now, in future videos, we'll talk a little bit more about what to do if you learn that you have insulin resistance, but the first step is knowing whether or not you have it. So if you enjoyed this video, please hit the like button and subscribe for more metabolic and psychiatry content.